Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is 5 things to know about epidural steroid injections. Epidurals were first performed in the 1950s for pain relief, and their purpose is to relieve the pain from pinched nerves. They're most commonly performed with cortisone medication, also known as steroid. The first thing to know is the indications. Now, it's for a pinched nerve that's coming from either a herniated disc where you have sciatica. So what you see here is a disc that's herniated and pushing back on a nerve root, and the redness refers to inflammation. Now, this can occur either in the lumbar spine, where it's called sciatica, or up in the neck, where it's called radiculopathy. An epidural can work well for either. Spinal stenosis is where you can have pinching of one or multiple nerve roots from an overgrowth of soft tissue or arthritis with bony overgrowth. And then you can have degenerative disc disease, where you can have a bulging disc and it's pushing out and irritating a nerve root in the same type of fashion. The second thing to know is how epidural steroid injections work. Cortisone is a hefty anti-inflammatory medication, so when you have the inflammation in an area like this with the nerve root getting pinched, if you bathe it with steroid, that can produce effective pain relief by dying down that inflammation. It doesn't cure anything, but it can work well for pain relief for weeks or months, and it can allow this piece of disc to slowly dissolve. The body knows it's not supposed to be there. The third thing to know is that there are 3 different kinds of epidural injections. The first is called an interlaminar injection. This was the original type of epidural, and it involves simply placing steroid medication between the lamina, which is the bones of the spine, through the soft tissues and around the epidural space. Transforaminal is the newest type of epidural, where you're putting the steroid medication really right where it needs to go, more closer to the area of nerve root pinching. And then a caudal, we'll look at that in a second. Interlaminar, as you can see, it goes between the lamina here and here, right there. Transforaminal, you can see that it goes out where the nerve root is actually getting pinched. This is called the foramen, where it's coming out. Okay, so that's more about the last 10 years. And then a caudal is actually, this is the bottom where the sacrum is. There's an area called the sacral hiatus. The epidural injection goes through there. The steroid medication is a larger volume that's put in, and it can migrate up and hit multiple areas if nerve roots are getting pinched. So for spinal stenosis, if you have multiple nerve roots getting pinched, that can be a great one to pick. The fourth thing to know is the outcomes. There have been dozens of studies performed in the last few decades looking at epidural injections, and overall 75% of patients receive good to excellent outcomes. The best studies to use when you're looking at these statistics is ones that have randomized patients and they use fluoroscopy, which is x-ray guidance. If they didn't do that, those studies should not be seriously taken into consideration. Outcomes, a prospective study of patients with radicular pain caused by degenerative disc disease found that after transforaminal injections, 75% of patients found at least a 50% reduction in pain. Almost 2/3 had improved walking tolerance, and 57% had improved standing tolerance at 1 year. So very impressive. The fifth thing to know is that epidural steroid injections are not FDA approved, but they are not FDA denied either. It's called off-label, just like 40% of medicines in this country. Lots of treatments that are not FDA approved work very well for indications that they were not initially approved for. So the bottom line is that effective treatments for pinched nerve conditions are what epidural steroid injections have proven to be over the last 60 years. They're outpatient, they have very low complication rate, and they can be repeated. For instance, if you have sciatica, you can actually have a series of 3 epidural injections for maximum effect, and then it can be repeated a few months later. The top pain management clinics in the Denver metro area are Colorado Pain. They offer medical and interventional pain management at several locations. They accept over 50 insurances. The number to call for treatment is 720-306-9575, and visit us on the web at coloradopainnetwork.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.